On this episode of the ASC Podcast with John Goehle, we discuss the Indiana Federation of ASCs 2022 Spring Conference and Trade Show, held April 22nd, 2022, and interview the association president.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. This episode is sponsored by Surgical Information Systems, providing cutting-edge information solutions for surgery providers, and Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 159 of the ASC Podcast with John Goehle for June 4th, 2022, recording from our studio in Spencerport, New York, and from the Indiana Federation of ASCs 2022 Spring Conference and Trade Show in Carmel, Indiana. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. The ASC regulatory environment is extremely dynamic, and the material provided in this episode is based on information available as of the date of the recording. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies and recognized as one of the nation's leading experts in the ambulatory surgery industry. Mr. Goehle is the author of over 10 books on the ASC industry and a frequent industry speaker on regulatory accreditation and finance issues.
So this is going to be a very short episode. Unfortunately, while we were in Indiana, we didn't have an opportunity to interview many people. And in fact, most of the speakers were people from Ambulatory Healthcare Strategies, and the topics that we talked about were things that we often talk about on the podcast. So it was my first time being there. I believe it might have been Ann Geyer's also, but we were both in attendance and speaking. So, Sue, it was great to continue to go out and see some of these conferences. There hasn't been as many as there have been in the past, and again, getting to meet people in Indiana for the first time was fun. Because this was our first time, we really didn't have an opportunity to record too much. I was able to interview the president. We're going to do that interview in a few minutes. And I did want to point out that they do have a fall conference coming up on September 9th, 2022, and it's going to be at the Embassy Suites in Plainfield, Indianapolis Airport in Plainfield, Indiana. It'll be their fall conference, as I said. So, Sue, I just wanted to kind of run through the agenda so people know the types of sessions that were held during the conference and encourage people from Indiana to show up. So it started out with a welcome from the president, who is Talitha Mortimer, and she's the person we interviewed a little bit later. And then we had a wonderful presentation from Ann Geyer on human resources and an administrator's checklist. And this was a great presentation on how to oversee the human resources function, which Ann always does a great job. And of course, Ann is the Chief Nursing Officer for Ambulatory Healthcare Strategies. And then she went on to talk about, my favorite presentation actually was on improving patient satisfaction. And we're going to have her on a podcast coming up to talk about that topic. I'm actually going to try to get her up at another state association meeting soon. And then just before lunch, we had an ASCA update, and Bill Prentice, my dear friend from ASCA, was there to kind of talk about the various issues that are going on at a national level. And then the best presentation of the whole day was at 1:30 on revenue cycle management.
Who gave that talk?
That was me. I don't know. Why do they always put me on after lunch, on a topic as dry as finance, when it was very clear that most of the people in the room were, nurses. But hopefully we had a lot of fun there. And then unfortunately, I had to leave shortly after this one started. But Penny Smalley did a presentation on, are you ready to take control of surgical plume? From awareness to action. And you've talked about this, Sue, a couple times with me, and it really hadn't sunk in until I kind of saw her presentation talking about some of the risk factors in having smoke evacuation systems built in. And since this conference was done, the state of New York actually is working on on making it a legal requirement in the state. So I know that many other states are doing the same thing. I don't know what's going on in Indiana at this point, but her presentation hopefully started to change some minds and make people realize the importance of handling that. And then they closed at about 3:45. So it was a relatively short conference, a day, but a lot of great presentations. And I had a lot of fun getting to meet people from Indiana. Let's take a short break and we'll come back for a very short interview with Talitha Mortimer. She's an RN, BSN, and CASC, and she is the president of the Indiana Federation of Ambulatory Surgery Centers. And she talked a little bit about what the association does and other activities that the Indiana Association is involved in. Our listener patron program, also known as ASC Central, has really taken off over the past 12 months, and we are so grateful to all of our over 100 members. Our patron members help support our efforts here on the podcast and get a number of great benefits also. The ASC Podcast with John Goehle is the longest-running podcast dedicated exclusively to the ASC industry. ASC Central provides members with a wealth of management tools and resources, including regular members-only Zoom sessions with John and other members to discuss relevant topics, quarterly Zoom meetings where we update patron members with important issues in the ASC industry, periodic study sessions for leaders that are planning on taking the CASC or CAPE exam, and access to a large database that includes federal regulations, interpretive guidelines, and the state regulations, checklists for administrators and nurse managers, example meeting minute templates, example policies and procedures, budgeting and financial projection tools, risk assessments, and example forms, and much, much more. Members also get discounts on books written by John Goehle, ranging from $10 to $80 per book, and can even schedule a personalized mock survey with John and save over $1,000. For more information and to access this additional content, please visit ascpodcast.com or asc-central.com. So I'm here at the Indiana State Association meeting. This is your annual meeting, correct, Talitha?
Yes, we actually have a meeting in the spring and in the fall.
Okay. And with Talitha, she is the president of the Indiana Federation of Ambulatory Surgery Centers. And thank you for inviting both myself and Ann Geyer with Ambulatory Healthcare Strategies here to your state association. It's been a pleasure working with you. I haven't spoken yet, but Ann was kicked off the whole meeting early this morning, and she did a great job.
Yes,
so.
You're very welcome. You both always bring a lot to the table. We learn a lot from you. Thank you.
So we're doing a special episode here to kind of highlight what's going on in Indiana and give you an opportunity to tell the audience, especially those in Indiana, about the benefits of being a member of the state association. So why don't we start by talking about what the Indiana Association does for its members?
Okay. It's the Indiana Federation of Ambulatory Surgery Centers. We've been around, I would say, 30 to 40 years. I know when I helped build our surgery center 20 years ago, I was told, make sure you always attend every IFASC meeting, and that's 2 a year, because we give out a lot of valuable information, and also networking is so important. You will learn so much from everyone that's here. We focus on emergency preparedness, advocacy, lots and lots of things in the surgery center world. Our mission is actually to assist Indiana surgical centers to excel as a distinct healthcare model for the delivery of safe and affordable surgical care. And I think ASCs are wonderful, and patients get great care there, and it's affordable care.
Right.
And we want to make sure we get to stay in business. And I think by belonging to an organization like this, it just strengthens your place in the ASC world. You know, we have people that go lobby and all kinds of things at a national level as well as a state level, trying to get us maybe a better reimbursement and that sort of thing.
So how many members do you currently have in the state association?
I don't know, probably maybe 100.
Okay. And now you do 2 conferences a year, right? Are they one in the spring and one in the fall?
Correct.
And do they have a focus, or are they just an opportunity for you to to come together twice a year?
Well, we actually talked about that at our board meeting last night. The audience really is geared toward administrators or nurse managers.
Okay.
The rank and file employee is probably not going to really learn much here.
Right.
Because we're talking about all the rules and regulations we all have to follow, which are so many, right?
Yeah.
You have to follow Medicare rules and JACO or HHC rules, State Department of Health rules, infection control rules. I mean, it just goes on and on. Because I feel like an ASC is like running a small hospital, only we are all those departments.
That's right.
And that's a lot to have to know.
And you don't have the backup that you have in the hospital.
Correct.
If a toilet has to be cleaned, it's often the administrator that's stuck doing that, or the nurse manager.
That's right. That's right.
Tell us a little bit about some of the legislative issues that you've been confronting in the state within the last couple years.
I think the main one in the state of Indiana is our workers' comp issue, because we don't get reimbursed near as much as a hospital gets. And we just went through all this with the legislative session, and we didn't really get anywhere.
Uh-huh. But you're still continuing to work with this. Do you work with a lobby group?
We do.
Okay.
We do.
And are there any other items on the legislative agenda for this year, or is it a relatively quiet?
No, that's the main one. That's the main one as far as ASCs go, of course.
Right. Well, it's good. I mean, knock on wood. We're luckily in a conference room here with wood, so we'll knock on that
exactly.
to try to avoid.
Better than my head.
Yeah, right. So tell me a little bit about your fall conference.
It is on Friday, September the 9th, and we usually get started around 7:30.
Okay.
And we always serve a nice breakfast, and we have great speakers. We have exhibitors that come. Mm-hmm. Oh, man, we probably have 50 or 60 exhibitors today.
Wow.
And that's always fun to get to know all the new and exciting stuff that's out there.
Mm-hmm.
And personally, I like, winning those prizes and stuff that all the raffles they have.
I think what's nice about as I was walking around the exhibit hall is because it's more concentrated here. It's not like you and I are going to ASCA next week, which will be so huge compared to this. Here you have a little bit more time with the vendors. You can ask them questions without being interrupted constantly. So
exactly.
I think that's a nice advantage of these state association meetings where
right.
you can really sit down and even grab them. You had a long break, for example, between the last two speakers to talk about that.
And I think the other thing for administrators and nurse managers, we work so hard and we put in so many hours in the office. Mm-hmm. It's nice to get out of the office twice a year, come to a nice place, have a meeting, nice lunch,
right? Get
to meet a lot of people and network.
And what do you think about the networking? In other words, how does that work here? I mean, is it quite effective? Is that probably one of the major benefits for your membership? It really
is. And like I said this morning when I kicked it off, if you have any questions about anything, you come and ask me. If I don't know the answer, I'll find one. Right. But I used to come here every meeting with a list of questions because rules change so much,
right?
And especially the State Department of Health.
Yeah, and of course under COVID here and all the stuff going on at the federal level. Right now, as you and I are recording this, Bill Prentice from the ASC Association is speaking about what's going on at the national level too.
Right.
And where is your fall conference going to be?
It is going to be at the Embassy Suites in Plainfield, Indiana.
Okay. Wonderful. Well, I really appreciate your time, Talitha. It's been a pleasure meeting you. And this is Ann's and my first time here at the conference. We've enjoyed our stay here, and we hope to be invited back. And next time we'll try to do a little bit more interviewing of the speakers too.
I love it. Thanks a lot. Appreciate it.
Thank you.
We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, and Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast has been an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.